We'll now have our panel discussion, which will be a combination virtual and live. And Mario Cascio from Italy will join us. And I'd just like to briefly introduce him. He's been living with HIV for 40 years and has been an important contributor to all of the issues that we're discussing today, focusing on HIV and aging. He's a founding member of the Italian network of people living with HIV and former chair of Quality of Life Program, a European AIDS treatment group. He's also a steering group member of the HIV Outcomes Initiative, focusing on long-term management of quality of life in people with HIV, as well as a founding member of the ICOPE HIV, an international coalition of older people living with HIV. Thank you very much, Cascio, for joining us.
Thank you, Scott. Thank you for the introduction. And it's a pleasure to be here with you all today. I wanted to thank also the speakers of the previous session and of this session here for their very interesting presentations, very much appreciated. And I'm happy to be here to discuss one of the topics which I am very interested in, which I think are very relevant for the well-being of the people living with HIV, sarcopenia and frailty. So I believe that these are two conditions, two health conditions that can have a strong impact on the daily lives of people. So it's very, let's say, find ways to prevent, mitigate, or even treat them.
Wonderful. Well, thank you again for joining. As we start, are there any topics in particular you'd like to discuss, Mario?
Well, what I would like to discuss about frailty and sarcopenia in general, and maybe my personal story can somehow help in this, let's say, because it describes, let's say, what my experience with sarcopenia and frailty, and the way I have, let's say, I'm responding to it, and going back to what has been discussed today about what the importance of exercise and other things such as nutrition can have on improving your state of well-being. So I would say, let's say, last year I had a problem. I started to experience some physical problems. I was feeling weak. Not understanding well what was happening to me. My ID doctor was saying, I had a pain in my neck, which was probably due, that's what I thought, it was probably due to some kind of arthritis. But that was not the case, because I went to a friend of mine who was an osteoporosis, and he was telling me it has to do with muscles. So my ID doctor didn't tell me much about what could be happening. But I thought that something was going wrong. And what I did is I went to a specialized clinic in North Italy, and the metabolic clinic in Modena, led by Professor Guaraldi. And there I found out that I was told I had sarcopenia. I was told I was in a pre-filled state, and that I was also in a depressive mood. So this was very, let's say, enlightening to me, because it actually gave me a chance to understand what was happening to me and what I could do to change things. So what I was prescribed was to exercise. Of course, we've been talking about exercise, the benefits of exercise. I have never done so much exercise in my life, actually, but I finally understood the importance of this. But most of all, I was focusing on nutrition, because unlike what I personally thought, my diet was totally, let's say, unbalanced. I was undernourished, underweight. I lost about 4 or 5 kilos in the last year. I had lost. And so, and I actually thought I was eating the right things. So it was very surprising to find out that I was eating actually the wrong things and in the wrong quantities. So this helped me a lot. So I started with a program, a nutrition program, putting in proteins and carbohydrates and so on, and balancing my diet with vegetables and fruits, something I had never thought about in the past. And so I radically changed my way of eating, my food intake my daily food intake. And I did this for the first couple of months. because I wasn't feeling, let's say, strong enough to start doing exercise. After a couple of months, I started seeing the benefits of what was of my difference, let's say, my changes in nutrition, and I started exercise program. An exercise program that I was, let's say, suggested to do some resistance exercise and also aerobic exercise. So I've been doing this for the last 6-7 months, and I must say that I have actually saw the benefits. And also what changed was the fact that the depressive mood I was feeling was actually related to this weakness I had in my muscles, in my weakness and so on. That changing that actually changed also my mood. This was also very motivating for me and took me a bit to move ahead. But as we have some of the speakers have mentioned, adherence can become a problem because, in my case, for example, I had to interrupt last month because I underwent surgery, and it was not a very serious surgery, but it was something that kept me, away from doing exercise for about a month and a half. And I must say that restarting is, let's say, a bit more difficult. My doctor has been telling me, you're 70 years old, and doing your exercise, gaining weight, gaining, let's say, muscle mass and gaining strength will take you longer. You have to be patient. And this is, I'm realizing that, yes, I am getting older, and I must, let's say, understand also, let's say, have patience, not in the way I do things. So this is just to say that in my case, but I think in many cases, exercise and nutrition can be a very great, let's say, a component of overcoming situations of extreme frailty or extreme of muscle loss and muscle strength. And
your story raises several issues that I think affect many people with HIV, and one is, awareness of the problem, so that people seek care, and then the agency to go and get care and to adopt it. So knowing who to go to get help, and then how to maintain motivation, particularly when life intervenes, right? When something happens. And then also a question raised in part by Peter Wasserman online is also, what if you don't have access to a gym? What if, I know Jules Levin, who also has a question that's we'll get to in a moment, but has asked about, about disability as well. If you can't run, if you have other problems, what alternative exercise regimens are there? So those are just a few large questions. But Peter Wasserman asks, are there any equivalent regimens for patients who don't have access to a gym? So I don't know if anyone would, of our speakers or would like to answer that, or Mario, if you have a comment.
Well, regarding your first question, I think somebody else wants to speak first.
Yeah, if you don't mind, maybe Dr. Erlandson here could comment.
Sure. I think there's certainly, we touched a little bit about this in the Q&A earlier, but I think that there's always exercise that people can do, even in critically ill patients that are in the ICU. The physical therapists will come by and do leg movement exercises and small weights in bed. So even bed-bound individuals can do some sorts of exercise. I think it's simple things like standing up from a chair if someone's able to, lifting weights in the chair, doing balance exercises, trying to lift leg from the side on a chair. So there's lots of different exercises, and one of the positives of COVID was actually having a lot more access to some of these online resources that oftentimes are free. Silver Sneakers has several online programs that are free for older adults and can find videos online. So I do think there's options for people regardless of their level of function.
Yeah. And as you mentioned before, anything is better than nothing.
Yep, exactly.
Yeah. And regarding that first question, I think that you were raising, Scott, yes, I think there is a need to have some sort of, raising awareness, because, people living with HIV, somehow have little understanding of what frailty and sarcopenia can mean to them. And I mean, we all know that not all of us age in very different ways. Not everybody will age in an unhealthy way. But I mean, as we have seen, that people living with HIV are, let's say, at higher risk of experiencing frailty than the general population. So I think it's something that we have to, let's say, know how to communicate to people. During one of our surveys, for example, there was a 40-year-old advocate who was saying, I'm very interested in anti-aging issues because I want to know what I can do today to, let's say, to modify some of the health issues I may experience in the future. I may not, but I may experience them. And today we have a clear, in these conversations we've been having, in these presentations, we see there's a clear way of, let's say, somehow preventing conditions such as frailty if we, let's say, anticipate them earlier.
So that actually touches on Jules' question, Jules Levin, who asked about the extent to which, if you don't mind, Jules, if I paraphrase it a little bit, but the extent to which younger people with HIV are at risk for frailty and other conditions, you know, does the difference between people with HIV and people without HIV grow with chronological age, or do the curves, you know, approximate each other as people get older? So are younger people at much greater risk for frailty than younger people without HIV, or is the risk sort of fixed across the lifespan?
Data from the multi-center AIDS cohort study and the Women's Interagency Health Study have primarily shown that difference accelerates at about age 50 to 60, at least in regards to gait speed and grip strength. However, a lot of those patients or participants in the studies were exposed to older antiretroviral therapy and are different than someone who is diagnosed with HIV today. So I don't think we know yet about someone who has a new HIV diagnosis today, but I think based on kind of our general population, it seems to be differences that we see generally starting at about age 50 or 60 and increasing with aging.
So let's take questions from the room here, with apologies to Joseph C., who I think I know who he is, from San Diego. But Joe, if you don't mind, we'll take a couple questions here in the room. Number one.
Hi, thank you, Alan Winston from London. Christine, thanks for a lovely talk. We've heard a lot about obesity and frailty and sarcopenia. When we're understanding more and more that some of the antiretroviral drugs are probably weight suppressant, and some of the antiretroviral drugs are probably appetite stimulating or increased weight. What impact do you think that has on these aging phenomena, and what's that going to mean going forward?
Mm-hmm. I think we're limited because a lot of those studies don't include measures of body composition. From what we've seen in the ADVANCE trial, the arms that received dolutegravir the dolutegravir regimen tended to have more gain in lean body mass along with gains in fat mass, whereas the arms that received efavirenz tended to have much less gain in lean mass. Again, going back to the question whether DEXA is the right measure to be looking at these two, so I think that raises ongoing questions. Ideally, we have additional measures of body composition in some of these studies too. But I think we do tend to see gains in lean mass along with overall gain in weight with those regimens, and suppression of lean mass in those receiving efavirenz-based therapies.
Okay, microphone number two.
Marie-Josée Bruyette from Montreal. Thank you both for fascinating talks, and thank you, Mario, for your perspective. I want to pick up on a couple of things that Mario mentioned and that were mentioned during the presentation. One is the increase in IL-6 after exercise. And in fact, some people after intensive exercise experience a decrease in their mood. They feel awful after exercise, and IL-6 is related to depression. So is this different in persons living with HIV versus without HIV is one question. Do we know about that? And the other question is about the impact of nutrition. There's a lot of interest in intermittent fasting, long-term fasting, ketogenic diet. So has there been any studies looking at that and decreasing fat in persons living with HIV?
Okay. So the IL-6, Grace didn't present it in this, but we previously published on our changes in IL-6, and we saw huge variability in what inflammatory response is. Some people increasing like 200% after acute bouts of exercise and others decreasing. So I honestly don't know what to make of the inflammatory data after exercise. We saw that both after an acute bout of exercise as well as kind of over time. The IL-6, that's really interesting if those that feel worse after an acute bout of exercise might have a difference. I think that's a really interesting theory. Certainly we're seeing that some with the long COVID population, is some people feel horrible after exercise and whether that could be related to inflammation. So I think that's really interesting, something we haven't looked at. And then the other question on, why am I blanking on what your second question was? Ketogenic, okay. I have not seen a lot with specific diets with HIV as of this point. I know I've had a couple patients that have attempted to do ketogenic diet and come back with LDLs of 300 and promptly told them to stop the ketogenic diet. So I think there may be some extent of ketogenic diet that works. I think we still have a lot to learn about some of those diets and people without HIV as well. So I think it's definitely an area of interest. There was I know there's a little bit of interest in ketogenic diets may have some mitochondrial impact, and so whether that could have a potential mitochondrial benefit, I think is also unknown, but it's balancing it with the safety of cardiovascular disease and changes we might see in lipids as well.
All right. Well, I want to thank Mario for his time and apologize to those of you whose questions we didn't get to, but there is a session directly following this, so my apology also to Drs. Ziegler and Green for making you a little late. And just to remind everyone to please fill out the feedback forms. And I was also asked for people who may have arrived late and didn't hear the earlier announcement that there are still spots open for the dinner tonight. And so if you're interested in attending the dinner, please see one of the conference staff. So thank you very much.